Excellent. Thank you, Kiko. All right. So on your Jamboard, as you're seeing mine up at the top here, let's hit the arrow here to scroll to page 5 for challenges. So we started talking about strengths and opportunities just to kind of, again, get that excitement rolling and kind of really see where great work is happening. But we do want to circle back around because when there is great work happening, we also have to recognize what those challenges are. I think one of the mantras that I always like to stick with too is that when there's a challenge, there's always an opportunity. But if we're not recognizing those challenges, then we really lose out on moving something forward, maybe in a different direction. And so thinking about the strengths and opportunities that were discussed before, if you want to go ahead and grab your sticky note feature, we're going to take a couple of minutes here to kind of reflect and post thinking again about physical activity policy. What challenges might you all be prepared to overcome in the future? What are some of those challenges that may happen? And again, sector and organization lenses, bring both of those to this discussion. Great. When you're thinking about the work that you're doing within the sector that you're representing here today, also thinking about, are there challenges with working from a cross-sector perspective as well? So think about maybe some of the challenges that might pop up there too. A little bit of that is represented here already. Any other thoughts? What are some themes that are showing up here for challenges?
Time and staff,
Okay, yep.
and that can link directly back to funding.
Okay.
I see a couple around like restrictions of the organizations that we might work for,
Mm-hmm.
marketing restrictions, policy agendas, pre-assigned policy agendas.
Mm-hmm.
Policies being hard, because they are.
Mm-hmm. It's daunting work. Yes. Yeah. Yeah.
And I do like the not speaking the same language one.
Mhm.
Yes, that, amen to that. That has been a huge challenge.
Does anyone want to say any more on that? Just to elaborate. That's a tough one. It really is. And what to do to overcome it is, yeah.
Yeah, I mean, it's so hard when like, I'll just use, since we're picking on Mark today and Patrick, I'll just continue to do that, you know, like, some of our work with Mark has been around, you know, like transportation policy, and, you know, there's things there in terms of, you know, I don't even know if this is right, but I'll say like lane widths or density or things like that, that like, you know, I know nothing about. So it's hard. It is a challenge to kind of communicate, you know, what one group wants to another group who wants the same thing, but just calls it something different. I don't know. I don't always know what the solution is. I think I'll give kudos to Mark because and Patrick, because I think they do a good job of also like being interpreters as well too. So.
And I would encourage anybody, like if you're thinking like, you know, it would be great if there's a regional this or a regional that, get in contact with me or somebody else at Mark, and I'd love to take you through the regional efforts we do have going, and then it'll be way easier for you to spot like where are we still lacking, and or is there something we can take forward, or you know, it's we do have regional efforts going, and I don't think a lot of people know about them.
Yeah, Patrick, thank you for that. I'd love to hear more about that. I put in the question about questionable lack of regional coordination of efforts. I've been involved for a while in some of these things, and that seems to be a recurrent observation of mine. Whether it's accurate or not, I don't know. And that's why I turn to Mark when I think about regional leadership on these things.
Julianne, I moved some sticky notes. I'm sorry.
That's okay. No, that's okay. Yeah, I think, and you know, this is your process and your time, so feel free to participate in that as well. Yeah.
So I think staffing might have another tie-in to like these three things: the lack of regional coordination of efforts, the cross-sector not speaking the same language, and then not having staff to be at those meetings to be aware of the work being done. I feel like those all kind of tie in together. And then also the community groups doing duplicate work, and then not being at the table to have those conversations. So I know that's been a big challenge, is not being able to talk with some of those folks. And they're like, hey, we already have this going. It's like, how can we help you? How can we join forces? But then we can't ever make that happen. And that goes back to policy and some restrictions. I know sometimes some agencies aren't allowed to have church groups or other community groups join some of these programs and or efforts because separation of church and state, which is really hard. But then other times other groups are, and so they're able to make headway. Well, we just want to help provide those resources and help out.
Mhm. Excellent point. Yes. Yeah, thank you, Allison.
And I remember, Allison, in one of our park sector meetings, like we just kind of had an open discussion time. And I just remember walking away, every single participant was like, we need coaches, instructors, we need this, we need that, and like that, that is like the immediate need. And like, in a case like that, you guys have to devote your time to addressing that immediate need. And, policy is kind of a larger overarching thing, and when you don't have time to deal with those overarching things, it's a huge challenge.
Mhm.
Well, and then folks not being able to dedicate time to address those issues. Just,
Right.
I mean, we just had our all rec staff meeting this morning and our concession stand hit high records, but they limped through the year and they were way understaffed. I
Mhm.
mean, they had overtime, insane amount of overtime, comp time, all that. But they still hit their stride, but they also lost some staff just because of burnout.
Mhm.
So
A lot of things to juggle. Yeah.
The comment right in the middle, the blue comment in the middle about
Yes.
allowing those who are systemically underrepresented to invite us to their table and tell us what they need, even though we are considered experts, they are experts in their community needs. I mean, this is so true. You see it all the time where, hey, Children's Mercy is as guilty of this as anyone. Like, they do a program to try to address a need, but they have failed to actually talk to the people that they're trying to help to see what actually the need is. And they're providing, a program or a service that is not helpful in any way.
Mhm.
And it's such a big problem. So I completely agree.
Mhm.
I'm going to say that Parks and Rec is also very guilty of this. We'll get requests for programs, but then we don't actually get connected. Like the coordinators running programs don't get connected with the person who requested that program. So we don't know when they actually want it, what time of day, like what
Mhm.
time of year. And then it's a missed connection. And then when we do get those programs up and running, it can be a slow buy-in process from the public, which then results in canceled programs
Mhm.
and us not be able to do it with a lot of our programs being enterprise-based. And that goes back to funding as well.
Mhm.
Yeah, and obviously communication, right? Yeah. So.
Yes. This is
Mhm.
a nice little spider web that we have up here, guys.
Yes, yeah. Well, and also I was thinking about this one too, in terms of they are experts in their community needs, but they're also experts in their own lived experience. And I think that needs to also be at the forefront when we're actually intentionally reaching out and asking what are the needs, is that we're doing it on a community level, but also on an individual level, so that there's space for that voice in the process as well, which can also bring challenges. Is it how to reach out, when to reach out, who to reach out to? Is there trust built in that community with those who are reaching out? Or is there a champion there that can help support some of that? There's just lots of things to think about, but it's still important work. And so this kind of leads us into maybe some of the next conversation, which is around priorities, is how do we take some of these challenges and really move things forward, being comfortable with facing that this is going to be a challenge, but here's why we're going to keep digging in. It's because you know, it's because of this particular reason, or it's not just because it's important, but it's because of specific things that you can actually identify that help lend itself to that process. So that makes sense.
Well, and I think one of the other problems that we've got, this ties back into the same language and then the underrepresented. We do all these surveys, we do all this data collection, but once we get all that data, it's how we're interpreting it and how we're molding it to actually fit to what we need. And then the same language, maybe we're misunderstanding the comments and or the data. And so that can be a huge problem as well. Which
Right.
then can result in these slow buy-ins. Like, that's not what we wanted. Like, what? How did you get that from that? So.
Yeah. Very good. Excellent points. I think part of what resonates with me with the work that you all are doing is that you do have that cross-sector collaboration piece that's in place, and some of those challenges can be addressed through just having additional opportunities for conversation or communication and sharing out, you know, here's the challenge that is presenting itself. Do we have somebody in one of these groups or in one of these sectors that actually is good at data interpretation, or, you know, that can kind of lend itself to the support across sectors, so within the work?
Well, and I think the other thing is how we're forming those surveys and the wording that we're using. And goes back to, we're not speaking the same language as some of our users, and it might be different.
Right. And that's where community members can come into play as well, is asking at that very beginning piece of, you know, part of that process is, we're developing the survey, but we need your help to develop the questions. Do you have somebody within parts of the community that you want represented, or that it's going to impact the most, to even lend their voice that early in the process? Yeah, very good. Okay. So part of what we want to do is kind of debrief for the 3 areas that we've focused on today. So strengths, opportunities, and challenges, thinking again from your organizational lens and the sector lens that you're representing here today. Let's reflect a little bit on, let's actually move boards first. So up at the top again, just grab that little arrow and move to board 6. And this one actually gives you the question that we want to kind of talk about and debrief and reflect on. So what are the 3 top 3 opportunities on which to focus efforts moving forward? So thinking about, how do we leverage the strengths? How do we take a look at opportunities, and how do we kind of address those challenges to move the efforts forward based on all 3 of those things? And so on one sticky note, if you can kind of put your top 3. So take a good 5 to 7 minutes to, you know, really kind of, that may be too long, but take 3 to 5 minutes to really kind of think through this. What top 3 things can you identify to focus on to move efforts forward from this point? And you should be able to scroll back through the board as well to kind of pull from some of those areas. Looks like we lost a sticky. Hopefully that was intentional.
I think they're editing it.
Okay,
Cause it said put your top 3 on one sticky note, and I only put 1 on one sticky note, sorry.
okay.
I'm gonna put up multiple sticky notes, that's a lot of words.
That's okay. Yeah, and I was gonna say, if it's wordy, you may need to use more than one, and that's okay. There it is. Okay.
I also did not mean to put anything up there. I just have my number 1 so far.
Okay, sounds good.
Oh man, mine disappeared. I don't know what I did. I screwed up something.
Uh-oh,
I'll try it again. Yeah,
okay.
fast.
I was gonna say, I haven't seen one recently disappear, but maybe it was that first one.
Is it on another board, Robin?
I don't know. Probably.
That's okay.
That would be my fault, because I didn't give good instructions to begin with. Mural, Jamboard, they're also just a little bit different, and it's hard to do these sometimes, but I'm glad we have opportunities for this, because then everybody can see it at once.
Yay, it worked.
There we go. Everybody have time to put something up that you wanted to, or do you need another minute?
Another 30 seconds.
Yep, you got it. So this one here is in place of this one.
Correct.
Okay,
And I still am failing to come up with number 3 on the same sticky note, but
and that's okay. If you would like to think on it still, you can still pop one in there. So we've got about 11 to 10 minutes left before we move back into the main session. So 2 things to accomplish before we do that. We'll talk a little bit about kind of themology here. You know, are there other ways to kind of help leverage these efforts moving forward? And then also, I do need a volunteer who would like to share out with the group, just a couple of takeaways from kind of what you've gained either for yourself as the group, this group, or across sectors, what you've gained that you feel like you can help move this work forward. So, any volunteers? Robin, I'm assuming it's going to be fairly short and sweet since we'll have 5 groups to report out.
Yeah, 2 minutes max.
Okay, there you go. You only have to do 2 minutes worth of sharing out. Just those
And,
high level themes.
Yeah, and you can use the Jamboards if you
Yes.
want to. So
I can share the screen and pull up whatever you would like.
If somebody could put together a brief summary of what we've done, I'd be willing to report out, but I have not taken notes to do that. I'm not sure I could do that by just glancing at the Jamboards either.
Robin, I can do it.
Okay.
Okay.
Thank you,
Great.
Allison.
thanks, Allison.
I was trying to count to 30 seconds to see if someone else would do it. But,
You
And my
practiced
effort was
this,
pretty
haven't
weak.
you?
and it was a good offer. It was. Unfortunately, I took notes. So
Thank you.
I was gonna say, I
Thank you.
took notes as well, but it's your work as a group. And so I think it's much more meaningful coming from those that are doing the work. So we're just kind of.
do we have to talk for a full 2 minutes or can it be shorter?
You can do less, you can sing, you can
Second.
pantomime, you can
Robin?
do charades.
You know what
You
I'm
have-
capable of. Don't touch me.
She's gonna whip up a quick game.
Yeah,
Actually, I did
Yeah.
a giant rock, paper, scissors battle this morning at my meeting right before this, and I gave out prizes. So it was a lot of fun.
There you go.
I think that'll work. That'll work here.
Yeah.
Okay.
Thank you, Allison, very much. And thank you, Ed, for the offer as well. Okay, so again, looking at these different areas, we've got some around communication, building trust, better messaging, kind of determining where some of maybe that regional crosswork can take place, marketing, working with city officials, lots and lots of different ideas on moving efforts forward. So what stands out to you all as a group?
Getting the decision makers at the table.
Okay. And speak just a little bit more about that.
Some of the city officials, also some more of the other folks that can take this information back to their work groups and actually implement it. Because I feel like that's another one of the big communication issues is an agency will send a staff person to these meetings.
Mm-hmm.
But what does that staff person do with the information after they leave? Are they going back and then directing it to who it needs to go to make sure that information is put out? Or does it just sit there on a piece of paper and a folder and then they only pull it out whenever they go to these meetings again? They don't actually do anything with it. So it's actually following through, taking action. And it goes back to the communication.
Mm-hmm.
And then also I would say the policies, there are some policies I feel that can be flexed and or there's a gray area when it comes to partnerships.
Mm-hmm.
And that would have to come from the top to give that blessing for those partnerships to be expanded.
Mm-hmm. Okay.
But yeah, I feel like a lot of this is communication and messaging,
yeah.
just kind of from the resounding, and then finalizing the plan and getting it rolled out. Like, yeah, and that also goes to communication and messaging, like
Mm-hmm.
who's actually going to take action, roll that out? What are we doing with that plan? And who is aware of it? Who knows about it?
Right.
Because it's honestly, the pandemic, going to virtual meetings, we can record all the meetings and we can share the information, but are those people who are getting the recording, are they watching them? Are they reading them? What are they doing with the information? Does it just sit there?
Mm-hmm.
So taking time to take action.
Mm-hmm.
And, you know, I like that you included messaging in there too, because, you know, as I was telling someone the other day, is I think if you're attending this summit, you've probably drank in the Kool-Aid that physical activity is good for you. But I mean, just honestly, we're in the minority probably. And like a city council member or something like that, they probably want to hear something like, how is it going to increase city revenues or tax revenues, or how is it going to improve the traffic in their neighborhood or things like that. And, you know, that's one thing that we need to figure out, is exactly what is it that they want to hear, and, you know, can we convince them that the things we want to do will help that.
Mhm.
Well, they want to know cost also, and
Cost, yeah.
what's going to be the benefit, cost versus benefit. So, you know, increasing health of a community and all these other features also makes a region or a community a big draw for employers, and a great place to live, and higher ranking on national surveys and all that kind of stuff.
Mhm.
So they're all and, you know, public health, of course, and all kinds of things that can be shared with them.
Mhm.
This is a little off topic. We may not have time for this, but a few years ago, from my Eastern Jackson County Lease Summit perspective, I put together what I call a healthcare landscape image with some organizations and things. If it'd be helpful to look at that at some point, I did that,
Mhm.
and I can share a screen on that if you want.
Yeah, so
I think we've got,
what's included on it again? Sorry.
It is what I perceived as healthcare providers and schools and organizations and businesses and health departments and insurers and funders and there, you know, all these things in the Kansas City area, and then you know why I keep coming back to, there's no coordinating body for all these things. At the very top of this thing, I added, let me see what I called that, Metro Area Health Board, which is something that does not exist and probably will never exist, but it's on that visual, if you want to peek at it.
Yeah, feel free to send that my way. We've only got a couple minutes left here.
Sure.
But feel free to send that to me.
Okay.
Talk about that
Cool.
outside. That's great. Thanks.
Thanks.
And I honestly, I just want to like toot the horn for Children's Mercy, because you guys have done a great job with the Kansas City physical activity plan and getting people to the table. It's just whether those people who are coming to the table are inviting other people to the table that they know can benefit. So that's a huge thing, is just reaching people and getting out to them, because Healthy KC, they have a ton of stuff. And I know there are so many offerings out there in the KC Metro, but again, it's really hard to get everyone at the same table. And so then there are some Healthy KC groups that are doing duplicate work.
Yeah.
They're trying to get people out. They're trying to get people moving. That's what we're all trying to do here too.
yeah.
Yeah, you're exactly right. And we'd love to, from our perspective, if something's being done already in a good way, it can happen over there. We'd like to work with you on it and be involved, but like, we don't have to have a working group on this or that if it's already in existence. So yeah.
Well, even just joining forces, because I know the Johnson County government, they have multiple divisions just at the one building. They have committees that are doing the same work, and we've finally got some of those guys to combine committees. Things are happening. It's very exciting, but it's just having that outsider, someone to look at the bigger picture and see it all. So Ed, your plan of the KC Metro, like, that's awesome. Like, let's get those people connected, get them together, plug them in.
Good deal.
And I think that just shows the importance, again, of that communication piece. It needs to happen way before the work even starts, before decisions start making. You know, it's that pre-communication that can sometimes set the stage for what's going to happen after. And so it's, who are you communicating with? What are you communicating? And then you have to also re-communicate throughout that entire process, because if you add one new partner, you need to make sure that they are brought in at the same, you know, they're coming in kind of behind the 8 ball if they're coming in late. So how do you wrap them around what's already been done and what value they're going to bring to this process at the stage that they're coming in? And so it needs to happen along the way across the process. So I love the thoughts that you're all coming up with today, because it really resonates with that piece of it. So, yeah.
Like huge group chat with all the partners. That way, like, hey, are you doing this thing? Yeah, I'm doing this thing. All right, I'm gonna jump on.
Yeah.
You know what I mean? It make things last.
Man, we were having a really good discussion. Then we got kicked back here. What?
I know Donald had the best comment of the whole day, and then it
We
was
did.
right in between. Yeah.
Dang it.
But solving all,
Yeah, you know, that's how it works. Like I had the most enlightening thing going, and then, you know, whatever.
well, let's see, I'm looking, looks like everybody's back into the room now. So what we're going to do is do a share back to the entire group from each of the individual breakout sessions. So each group gets 2 minutes to share what you discussed. I know that is not nearly enough time, but that's all that we've got time today. There will be additional notes and reports coming out of this that'll be more encompassing, but this will just be kind of a little taste of what happened in the breakout rooms. So we'll start with access room number 1. And I think Jessica was the facilitator there. I don't know who's going to be speaking, but feel free to unmute yourself. And Jessica, if you're sharing a Jamboard or your screen, you can go ahead and do that now too.
Blake is sharing for our group. Blake, would you like me to share any particular screen on the Jamboard, or would you like to just share?
I think I can just share.
Okay.
So hello, everyone. My name's Blake. I'm with the Unified Government Public Health Department. So we talked about access to physical activity opportunities in our community. We had a pretty good group of people. We talked a lot about schools and also like early childhood development. We talked a little bit about engaging with our elected officials and just engaging the community to bring some of those safety concerns forward. At the end of our discussion, we did end up talking a lot about, or a bit about safety and perceived safety and actual safety, and really also talked about just creating a culture of physical activity. So we talked a little bit about how like our parks are built. Maybe there is like a baseball diamond or something like that, and you feel like you have to play baseball in order to be in that space. So really talking about how could we talk to our residents and talk to families about you can be physically active in many other ways, just out in your community, and just understanding that will require some time in building trust and again building kind of that culture of it's okay to be outside and maybe just ride your bike or walk around your neighborhood and do stuff like that. We also those are the main things that we talked about, and we did talk a lot about local government. I think we had quite a few people in our group that was involved with that, and really just overall education and engaging with all groups of people, and just yeah, those were our main points.
Great, thanks for that. Thanks for that summary, and it's interesting, and I think probably everyone is hopefully you're having the same experience I have, is that we were talking about policy, but some of those same issues came up in our group around community or communication and partnerships. And so as we're hearing these updates, let's kind of think back to some common themes around them all. Access to physical activity was by far the #1 interest area as people registered. So we actually had 2 access to physical activity groups. So the second group was led by, or was facilitated by Zane. And I don't know who's speaking from that group.
I'm going to
That's
share my
me.
screen and invite Jody. Yeah, Jody.
Okay.
Yeah. So we had a good amount of people from different health or from different sectors talking, and we definitely have some good collaborative work that we can move ahead with. We were talking about with Kansas City, we have a lot of opportunities because we do have some beautiful parks. We have some good bike lanes. We have a lot of sports teams in Kansas City and a lot of different activities that kids can get involved in. But we kind of had the same discussion and we ended kind of in the same area with communication. Communication is hard to try to figure out what is accessible, what we have available, how our patients and family and friends can access these resources. So we kind of lumped our priorities into 2 different categories that can kind of be connected as one. So one of the priorities was creating the map of physical activity locations, gathering and distributing of program and resource information. So really this like side over here on the right, we really need to create our list, try to find our resources, talk with community health members and all the different wonderful organizations that you guys are involved in, and find that list, create maybe a central hub for that list where you can access it either in like a park facility or an online app or website, and then also how to communicate that out. So our other side of the priorities was communication. So talking with our leaders, getting feedback from Kansas City members as well to try to figure out how we can engage Kansas City into this priority as well, and then connecting the 2. So how do we connect both of these to get the word out there?
Great. Awesome. Thanks. Thanks, Jody, for that update. Let's see, policy was next. So Julianne was the facilitator and Allison is going to give us a summary.
Yes. Thank you, Allison. Would you like me to share the screen or are you good to go?
Share it, share on.
All
The sticky
right,
notes are
I will
beautiful.
share it.
A lot of good work into those.
Okay.
So crazy, Jody, you mentioned all that because we talked a lot about that. Just the Wellness Hub didn't come up. So messaging and communication, getting the word out there, and then also duplicate groups. We also talked about missing the people who need to be at the table to make those changes and just understanding what they actually want. We also talked about trying to get some of those city officials out there to also help us out in the decision makers and convincing them. We also talked about how different languages, back to communication, maybe some of the city officials are not speaking the same language as the community members that are actually requesting. And so they're misunderstanding what's happening. And then also not being aware of those resources. That was one of the other big things that goes back to communication is who in your agency is going to these meetings to learn about all these offerings, and then what are they doing with that information? Are they taking it back to their work group and sharing those resources with people who can actually utilize those and take action? Staffing and funding, and people actually being able to make the adequate time to follow through on some of these actions as well too. But a lot of it came to communication, messaging, and understanding. And then we also had one on, let's see if I can go find it. Policy. Policy is hard, guys. A lot of us are not policymakers. And so then when those do come out, all the legal jargon and all that, like might be missing the mark on some of that. And then we're also having struggles with restrictions to those policies and getting those city officials to get to the table to understand why some of those policies need to change. So that way we can provide access for all. Did I miss anything? Anyone else in our group? Donald,
You may have mentioned it, Allison, but emphasis on, a coordinating entity for all of these things, that crosses state lines, crosses county lines, et cetera. Thank you.
Donald, you had a really good one at the very end.
You mean okay, so
Yes.
so I was just saying, I think Allison brought up a point about having, one group is doing one project, another group is doing another project. We don't want to double dip. So it'd be great if there was a huge text group where we had all of our different partners on this text group. So when one sent out text, hey, I'm doing this project, someone else could be like, hey, I'm interested in that. I don't want to do it again. I'm hopping on, or something like that. That'd be awesome. I think that'd be awesome for all of us.
Yes, just sharing the wheels that you work so hard to create. So that way someone else can also duplicate that wheel and offer it in their area as well, in their community. So thank you, Donald.
Great. Next up, physical activity programming. That was Tina's group, or Tina facilitated.
I did. And I think, is it Chelsea? Are you sharing for us? And do you want to see the screen as well?
Yeah, you can show the priorities.
Okay, great.
So like all the other groups, we had a lot of the same conversations, even though we were programming, partnerships are key. In order to successfully do programming, we need to have the partners that are focusing solely on physical activity, the partners that are focusing on other health aspects, but, fitting physical activity into their work plans and the priorities is really key. And there's some great partnerships already. There's some great facilities with Parks and Recs. And obviously this Physical Activity Summit has brought a lot of those people to the table, which is always a positive thing, and kind of breaking down those barriers for communication, which was another priority, is the communication piece. There's tons of great programming going on in the community, but sometimes the communication isn't widely distributed to everybody. There's a lot of different priorities in programming. So sometimes all that communication, if it's not your focus, it's lost. But finding the new and unique ways to get that communication out. We talked about newsletters and social media, and just the non-traditional ways as well. Another priority is, when you're talking about programming, is to meet people where they're at. It's great to have people come to a rec center, but if that rec center isn't accessible, or that park isn't accessible for everyone, then sometimes that programming will fail. So really making sure that we're meeting people where they're at, and to engaging the other businesses or organizations in that community. We talked about, a grocery store that's a popular place, maybe a great partner to have, even though it's not physical activity, they can promote it. We can hold something at their grocery store that would promote physical activity. So all of those things, just inviting and inclusive, and meeting different languages. We talked a lot about signage, and how having different signages within parks or community facilities would be great. QR codes that take you to a different website, or having signage in different language just makes programming accessible to all different types of audiences. And then beneficial, right? So meeting parents and kids all together, all different ages. And, I think that's about the key things. And really, the last piece would be the innovative programming. Thinking outside the traditional activity, walking, gym, really trying to come up with some innovative, engaging programming. COVID obviously has allowed people to become very comfortable with the online world and doing things virtually. So how can we kind of still capitalize on reaching audiences using that method, as well as having, those central locations and parks and things that we can reach people at. So I think that's about it. And obviously there were several other conversations, but those were the key things we talked about for priorities for programming.
Great, thanks Chelsea for that update. And last group to share is professional development education. Sai was the facilitator there.
Yeah, and I think James was going to share for our group. James, would you like me to share my screen, or are you comfortable where you're at?
Yeah, if you want to share that kind of last slide, I think we can go over it from there. Yeah, so my name is Jay Robertson. I'm one of the sports medicine docs at Children's Mercy, and we're basically talking about different ways to educate amongst groups and even down to families and kids. And what we kind of decided was that there's got to be some collaboration amongst the different sectors to really find out, make sure we're really educating the right people, the people who want the education, and making sure that we're tailoring the education to whatever group we're talking to. And as I've seen, communication and different language kind of becomes a theme in different ways, I think, for all of our groups. But one of the things that we're really talking about is making sure that we aren't using jargon when we're talking to people, making sure we're using basic language that can educate everybody without people being confused or unsure of what acronym we're using and things like that. And that's something that needs to happen regardless of what group is being educated. But I think we've got within our whole KCPA plan a lot of highly educated and engaged folks who would be great resources to provide education. So I think that's where we've got some really good strengths in this group, and just making sure that when we do those implementation things that we do bring in the different sectors. Also, a big part of education is making sure people can actually get to it. So making sure that we give plenty of different opportunities, whether it be in person or online or on demand, kind of education that we can get everybody involved with. And obviously different parts of our states and different parts of the region have different access to those things. So we really want to make it accessible to all. It was a really big point that we wanted to make. And then another thing that we really wanted to make sure is that we could engage leaders in the organization. So in a business or in a school district or anything like that, to actually give people the time to do this and talk about costs and how to mitigate that for the individuals and maybe get it onto the group. So that's most of what we were talking about.
Great, thanks, Jay. Thanks to all the groups for great summaries. Thanks to all the individuals for participating in the conversation. Obviously, that was just a snippet of what happened in all the breakout rooms. So we'll spend the coming days, weeks, and even months, really kind of better understanding what some of the themes and takeaways were from all of these breakout sessions. And that actually leads us to the end of the program and the next steps. Pull up my slide here. Sorry. So we've been recording all these sessions. We've been taking excellent notes. Of course, we have all the Jamboards from the individual presentations, and we're going to distribute all that information back to you, like I mentioned. We'll do that in several ways. One way is we do have a Kansas City Physical Activity Plan YouTube channel, and Katie might be throwing that in the chat if she hasn't already. This is where we have recordings of all those special events that we held in August and September, in addition to where we'll post some of the discussions that we had today. We also really try to prioritize communication through sectors that you've signed up for. So there are monthly sector newsletters that provide really good summaries of the things that we've talked about. And I'll show you in just a second on how to sign up for those sector updates and that communication in just a minute. And that brings me to, we hope that you join a sector working group. This is where the action of the Kansas City Physical Activity Plan really takes place, is at the sector level. And so the easiest way to be involved and to help with collaborative action across the plan is by getting involved in your sector work group. We'll show you on the next slide how to do that, but I strongly encourage you to sign up for one of those groups so you get those communications. Additionally, if you don't want to join the Kansas City Physical Activity Plan, if you don't want to join a sector work group, that's fine. This plan is a free plan. It's a publicly available plan. We would be ecstatic if we learned that some organization or some group all of a sudden went ahead and implemented strategies 24, 25, and 26 because they were part of some other working group from some other organization and were able to do it. That is what we want to do. Because if we get enough people implementing the plan, we feel we can make long-term changes in opportunities for physical activity in our region. So here are the upcoming sector work group meetings. So early childhood, healthcare, parks and recreation, sport, mass media and schools all have dates set. We have a couple other sectors that currently don't have meetings set, but will. But again, if you sign up for sectors, you'll get notified of when those future meetings happen. And again, Katie, I think, has put in the chat how you can sign up for those groups. And actually, it's on the screen right there too, Kansas City KCPhysicalActivityPlan.org/sector work groups. And with that, that concludes the 2022 Kansas City Physical Activity Summit. We're only 1 minute over. Thank you all for all of your work today. Thanks for joining the conversation, contributing to the conversation. We really appreciate it. And most of all, thank you for all you do for health in our region. And with that, I hope you enjoy the rest of your day and that we see you in a future sector work group meeting. Thanks, everyone. Have a good day. Oh, sorry, last one. I screwed up. Eval. This is the last slide. So we'll leave with this slide up. Please contribute. We do take your evaluations to heart. So please, if you have comments, not only about today's summit, but also the work in general, feel free to fill out this evaluation. And we look forward to hearing from you. Thank you.
Bye, everyone.
Hi, team. I'm just curious, who's still recording? Is anyone still recording?
Yeah, we need to stop recording.
Oh. I stopped my recording, so, and I was recording the main room, so I'm not sure if somebody still has theirs. I don't know how that works.